I'm Gary Phillips from Edgeworth in Newcastle, one of the top 20 breathtaking locations in Australia.
Recent data from the Australian Institute of Health and Welfare has uncovered some of Australia's top 20 most breathtaking locations. Breathtaking, that is, in reflecting the highest rates of hospital admissions for chronic obstructive pulmonary disease, or COPD.
When I was diagnosed with COPD, I knew there was something there, but I didn't know what, and I didn't really understand. You're sort of hoping it was asthma, but deep down you knew that it was more than asthma.
Gary is one of the 5% of Australians aged over 55 years who live with COPD, a serious, progressive and disabling condition that limits airflow in the lungs. Respiratory physician Professor John Upham explains the disease.
COPD is not a term that many people in the community know about, but from a medical point of view, COPD refers to chronic obstructive pulmonary disease, probably more widely known in the community as emphysema.
Gary says his symptoms often leave him feeling short of breath in the morning and at night, unable to carry out his day-to-day activities.
The symptoms I had was breathlessness mainly, and as soon as you try and do anything physical, like mowing the grass, walking upstairs, up hills, things like that, that's when you really felt it the worst.
When Gary was diagnosed with COPD, it was quite scary. I just thought that he would go downhill really quickly, which, he hasn't done, but it still made me really anxious.
The good news for patients like Gary is that a new COPD therapy called Britaris Genuair has recently been reimbursed by the Pharmaceutical Benefit Scheme.
We've generally thought that people with COPD have most of their symptoms during the day when they're doing things, but when you actually ask people carefully about what's the impact of the disease on their lives, you actually find that there's a lot of people that are experiencing significant shortness of breath first thing in the morning, even before they got up out of bed. And there are a group of people who are waking up at night as well. Britaris Genuair is now freely available to people in Australia. Just means that there's a lot more choices available for doctors and for patients in treating COPD. We can do something to improve their quality of life, reduce their symptoms, so that people can do more, so that they can enjoy playing with the grandchildren, walking down to the park, going shopping, continuing working if that's what they're doing.
Anyone experiencing the symptoms of COPD, which include shortness of breath and wheezing, are encouraged to see their local GP to ask for help.